You're watching Cetome TV. Knowledge is power.
How will I know if the chemotherapy is working?
Well, traditionally that's a long question.
Well, do your best. Give us a list. You're good at making these lists.
Typically what you see is the tumor shrinking.
Okay,
over
so you'd
time.
see it like on a scan.
Yeah,
You'd have
on
to
a
have
scan,
scans.
imaging.
Okay.
If you have a PET CT, you'd see the SUV going down. It's a serum uptake value. You'd see that going down. On liquid biopsies, you would see on a standard liquid biopsy that does not differentiate between the source of the DNA. In other words, looks at all of the DNA in the blood. During the chemotherapy, you'd see an initial increase in the mutation that you're tracking. And that's because the tumor cells are dying and releasing their DNA into the blood. And then a few weeks later, you'd see a significant reduction in the amount of the mutation.
Okay.
With the exosome-based liquid biopsies that we use, right away you see the reduction.
Right. You're looking at the data that matters.
Exactly. Exactly.
Got it. Okay, so it really depends on how your doctor's monitoring you, or how you've chosen to monitor your cancer care. A CT scan, not so accurate.
No.
Not recommended.
And that's because you can have the death of a tumor, but it would still remain intact. And it takes a while for your body to remove it, if it does, if it ever removes it.
Right. So if your doctor is just determining the success of your cancer care based on the size of the mass on a CT scan, that's not a very accurate assessment. A PET CT would be better. Yeah. Looking at those SUV levels, and then as you say, liquid.
Seeing if it's necrotic tissue.
Right, and then the exosome-based liquid biopsy. Those are the best ways to know, as well as your own self-report. How are you feeling? What are you noticing? There'll be certainly you will have had certain side effects or symptoms as a result of your cancer, and how are you noticing any exacerbation or lessening of those?
Well, yeah, I guess so. Some people are really tough. You know, I speak with people and they've got stage 4 cancer, and how are you feeling? Oh, fine. I feel good. I feel great. I don't even know I've got cancer, if the doctor hadn't told me. Yeah, exactly.
Yes, that is true.
And then you have people that are considered cancer-free and, can't get out of bed because of IBS or something like that.
Which, right.
So I don't like going with how you feel.
Your own self-report. No. I'm just recalling numerous conversations with people once they started, say, immunotherapies or targeted therapies, and how they are, how they notice how much more energy they have, just how much better they're feeling.
Definitely, yes.
But I understand. We definitely want more clinical data than that to determine that your chemotherapy is working for sure. And with the CT scans, it takes about 3 months to be able to start to have some of that information about whether your tumor is shrinking. And again, not very accurate in contrast to a PET CT. And with the liquid biopsies, let's say I started treatment today, how long would it take for you to tell me with a liquid biopsy if my treatment was working?
Literally probably about within 10 days.
Within 10 days.
10 days to 2 weeks.
Okay. So I could know
very quickly.
Pretty quickly if I'm on the right treatment and how well it's
and that's
working.
very important.
It is very important that you're on the right treatment, but also just for peace of mind and reassurance to know that things are working.
Well, especially if you're on an expensive drug.
Right. Yes, there is that. Yeah.
Thank you for watching Cetome TV. Subscribe below and stay informed.